I was looking for a college that was a small Christian university where I could integrate my faith into my learning and my passion for nursing, because I've always wanted to be a nurse.
I transferred from one of the larger state schools in Alabama and really was just disappointed with my experience there. I felt like I was just kind of a number. I wasn't really a person.
I really think that nursing is a calling. I really think that, it's best to have Christ's heart when you care for someone, and that's how you get the best compassion. And so that's really why I chose Sanford.
I felt like I could not only get a good quality education, but I was going to get a good character education too.
But you're also taught how to care to others, not just people like yourself, not just to your friends, but to a complete stranger that is sit there, sick, and you're their only source to an outside world at that time.
Looking at the School of Nursing, I just really like the student-teacher ratio, because I love asking questions. The teachers may not like that, but I'm just a questions person, and just the fact that I have easy communication with the teachers.
You have a name, a first name, a last name. I think my teachers probably know more about me than I know about myself. They're encouraging, they're uplifting. They hold us to the highest academic standard, but they always know that we can get there.
I feel like they're my mentors, they're my friends. I can go to them with an educational problem, a personal problem, family problem, and they will give me advice.
And when I came in towards Samford, one of the first things that really stood out about the nursing school was how nurturing they are and how much they really wanted to see me succeed. Samford has one of the most high-tech facilities for us to practice on, which I think is so important.
We have the clinical learning lab, and it's where we practice our basic skills for nursing.
So simulation really shows you how to put it into practice. You're given a scenario and you have to walk in, what do I do next? And so it really helps pull all the pieces together that you've learned in class, in the learning labs, and apply it so that if you ever see that situation, you know exactly what to do.
You can actually see flashback when you're doing your IV, and we did all of our checkoffs on there, and we really felt like we were talking to a patient. And so when we were going to our first clinical day in Foundations, we were like, okay, we got this, we did this before. So it just makes it more relaxed when you're going into that first day.
We go into the hospital and are able to perform patient care, and we're comfortable with our own skills because we've practiced so many times. And a lot of schools don't have what we have here at Sanford.
I definitely feel like an Ida B. Moffett graduate will be highly sought after, because it's the holistic care that we're learning here.
We all care about people, and that's one of the things that drew all of us to the field of nursing, is we care about people. And not just our patients, we care about each other.
We're learning about the diseases, but then we're also learning how to listen to the patient and look at the patient. And it's just, the teachers go the extra mile to make sure that we have that bedside manner. And all hospitals around the area, when you say that you're a Sanford nursing student, that carries something. And it's that reputation that is one of the reasons I came to Sanford.